it's Tove, and welcome back to the Dizzy Diaries, the podcast where we untangle chronic illness with science, storytelling, and just enough sparkle to make it stick. Today, we're talking about something that crept into my life quietly, wore a very convincing disguise, and turned out to be far more significant than I realized at the time. Neuropathy, more specifically, small fiber neuropathy. This episode is going to be clinical, informative, and grounded in science. I'll share my experience, explain what is actually happening inside the body, talk about causes, treatments, and why nerve healing is a very different beast to muscle recovery. Let's get into it. In the first few months of my illness, I had numbness, tingling, pins and needles, burning pain, and electric type zaps going down my arms and in my legs. And I ignored it. I told myself it was this anxiety and stress that the doctors thought was caused by being in the middle of university. I said, well, it surely will settle, but it didn't. The turning point was when I eventually saw a neurologist a couple months later, and she did what felt like a very simple test. It was a pinprick test on my hands and feet, and I couldn't feel it. Not just in one patch, not just mildly dulled, but I had no sensation up to my elbows and up to my mid-calves. It was a moment that everything kind of landed and this realization came over me. I was incredibly fortunate that my neuropathy was predominantly sensory rather than motor, meaning I could still move my limbs, I could still use them, it just felt distant. With these kind of conditions, it often affects the autonomic nerves as well, and this tied in with the dysautonomia that I was diagnosed with. But sometimes I would describe it as an out-of-body experience. It felt like I was in control, I could move, but it feels like your arms and legs are slightly unplugged extensions of you. That disconnect can be unsettling, especially when no one has explained what's happening. So let's dive into it and explain it. First and foremost, what is small fiber neuropathy? Small fiber neuropathy affects the small nerves or nerve fibers in the peripheral nervous system. Your nervous system is essentially an electrical communication network. Think of it as millions of tiny biological wires running from your spinal cord to your skin, organs, muscles, and blood vessels. There are different types of nerve fibers. You have large fibers, which are responsible for vibration, proprioception, and motor control, and then smaller fibers responsible for pain, temperature, and autonomic functions. When any of these fibers are damaged or dysfunctional, signals either don't transmit properly or misfire entirely. That's why symptoms can include burning pain, tingling, numbness, electric shock sensations, heightened sensitivity, or paradoxically, reduced sensation. And because these small fibers specifically also contribute to autonomic regulation, neuropathy can overlap with dysautonomia. These same fibers help to regulate heart rate, blood vessel constriction, sweating, and gut motility, which is why small fiber neuropathy is commonly seen in conditions like POTS and other autonomic disorders. Next, let's cover the topic of why does it happen. Neuropathy is not one condition. It's a result of nerve injury or dysfunction, and causes can include a range of things like autoimmune conditions, where the body actually fights against itself or causes this kind of damage, diabetes or impaired glucose tolerance, vitamin deficiencies, infections, chemotherapy, toxic exposures, genetic disorders, inflammatory conditions, and sometimes there are no clear causes that people can actually diagnose, but it can be a byproduct of something or another. In autoimmune-related neuropathy, the immune system essentially misidentifies nerve fibers as a problem and attacks them, which is what happened in my case. In other conditions, with some of the patients that I've seen, there is also chemotherapy-induced neuropathy, which can happen because certain drugs are toxic to rapidly dividing or metabolically active cells, which means they're doing their job, but nerves can become collateral damage in this process of trying to treat another condition. In metabolic conditions like diabetes, it can lead to nerve injury through chronic inflammation, oxidative stress, and microvascular damage. So there may be different root causes, but they can have the same outcome, which is irritated or damaged nerve fibers. As I said in the introduction, we can get these diagnoses and kind of determine what the cause is or what's going on in our body. But trying to recover or treat that is a really frustrating part. Muscles respond beautifully to stimulus. You train them, you feel them, they adapt. Nerves are more delicate. They tend to respond a lot slower. Peripheral nerves can regenerate to an extent depending on what's caused the damage and how severe the damage is, but very slowly. Roughly 1 millimeter per day under ideal conditions, and you have to remember that not every day is going to be these ideal conditions, and this is why it takes so long but consistent effort. That regeneration also depends on the severity of the damage, whether the nerve sheath is intact, so that's the layer that surrounds the nerve and protects it. We think about blood supply, inflammation levels, and the actual underlying cause that's being treated. If the underlying driver or cause is ongoing, like uncontrolled autoimmune activity, healing becomes harder because you're fighting against a system that's chronically or constantly causing damage. Also, nerves don't just strength train back into shape. They require metabolic support, reduced inflammation, correct micronutrients, time, and really time is the least satisfying prescription, but often the most accurate one. When treating neuropathy, the treatment falls into two main categories. Number one is address the underlying cause to prevent further damage ideally, and secondly, to manage symptoms. Addressing the cause may include optimizing blood sugar, treating any possible autoimmune disease, correcting vitamin deficiencies, adjusting chemotherapy regimens, and anti-inflammatory or immunotherapy approaches. Then we have the symptom management, so that you can kind of manage your day-to-day whilst going through treatment, and this can include different medications like neuropathic pain medications such as gabapentin or amitriptyline, topical treatments, gels, things like that, B12 supplementation when indicated, and graded physiotherapy or physical therapy to help maintain function and stimulate those nerve fibers slowly and safely. Exercise can play a role, carefully, gently, and progressively loading to improve that circulation and nerve health without overwhelming or overloading the system. And importantly, pacing, taking your time to allow those nerves to heal with giving them just enough stimulus and then enough recovery as well, because nerves that are irritated do not appreciate chaos. Now we're going to move on to the autonomic connection between small fiber neuropathy and how it affects our body. So for those people with dysautonomia, which can be from a range of different causes, this conversation becomes even more relevant. If small fibers that regulate blood vessel constriction are impaired, you can struggle with blood pooling, temperature regulation, abnormal sweating, and heart rate instability, because these nerves are not firing at the correct rate or receiving the correct signals and basically sending that back to the brain, which is why neuropathy and autonomic dysfunction often travel together or are paired together. It's not in your head, it's not weakness, it is physiology. Neuropathy can feel frightening. I know, I've been there. The loss of sensation, the burning pain, the disconnect from your own body, and unfortunately I see this every week with clients and people that struggle with this. But here's what I want you to remember. Nerves are slow, but they're not hopeless. The nervous system is plastic. We think about the term neuroplasticity. It adapts, it remodels, it can improve, especially when the root cause is identified and managed. I ignored my early symptoms because I didn't understand them, and now I do. And knowledge is grounding. It replaces fear with structure. If you're experiencing symptoms like this, advocate for yourself, ask about testing, ask about underlying causes, vitamin levels, and looking at the wider picture if the doctor is not sure what's going on. Ask about the autonomic overlap if you do struggle with that. You deserve answers. Your body is not broken, it's communicating, and we need to listen to it. And sometimes the quietest signals are the most important ones that we need to listen to. Thank you for joining me in this clinical deep dive into neuropathy. If this episode helped you understand your body a little better, please share it with someone who might need it too. This is the Dizzy Diaries. Stay curious, stay informed, and as always, take up space in your own healthcare story. You deserve it. I'll see you in the next one.